and it's Transformation Tuesday. So of course we have another amazing success story. You've seen many doctors on the show who have sought out Charles DeAngelo's help, and our next guest joins the list. This is a before photo of Dr. Chris Wongard, a local pediatrician, and drum roll please. Here he is now 140 pounds lighter. Dr. Wongard, please take a seat. You look incredible. And what a number. Everyone, did you hear that? 140 pounds lighter.
In 9 months.
What? My goodness, congratulations.
Thank you.
So how does it feel?
It feels really good to
Yeah.
be able to do all of the normal things again.
Yes. So describe your experience working with Charles.
So working with Charles, I know what I'm supposed to have been doing all of this time. But Charles gets very precise about it. He tells you this is exactly what you need to do. This is what's going to lead to success, and then helps hold accountability to actually follow through on it. And that's really what I needed.
Of course, because as you can imagine, for being a doctor, people might not think doctors need to take care of themselves too. So being able to fill up your own cup, why don't you talk about that, the importance of taking care of yourself and how Charles really helped with that?
I just feel so much better, and I feel like I'm able to do my job better. I'm able to take care of patients better. I'm certainly more credible for patients when we're talking about weight. So, but I also understand what they've been through because I've been through it. So it's really impacted every area of my life.
Yeah, that's a beautiful perspective. So Charles, you were saying, 140 pounds lighter, no surgery, no pills, nothing. That's unheard of these days, really.
Well, not unheard of. Here. Come on, Barry. We've been doing this, what, 13 years? Come on, 13 years every other week. Chris came to see me really frustrated because, as he said, so many people know what to do, but they can't get themselves to do what they know. So our work is really on the mindset, how to disconnect from using food emotionally so that you start to really look at food as just a fuel to get yourself to where you want to go. And like Chris said, when a client comes to see me, there's always two Charleses in front of them. There's this guy, the guy that's been fit for over 2 decades, but there's that kid that was bullied, teased, made fun of, ridiculed. And now Chris, having once been overweight and struggling like he did, when he's treating patients or when he's working on the administrative side of things in the health environment, he has a lot more sensitivity and empathy. And can you talk about what's happened from a health perspective, what you've been able to eliminate since you've lost 140 pounds?
Yeah, since I started, I no longer take medication for my blood pressure, and it's staying normal now. So.
And what about your waist? What did you tell me about your clothing?
It was 46 and things were a little snug, and now I'm 36 and they fit well.
10 inches.
Wow, well, my goodness. Okay, so doctor, what would your recommendation, if there was someone listening, they were hesitant, what would you say to them to pick up the phone and call Charles?
If you're having trouble doing it on your own, and say he will provide the accountability that you need to get from here to there.
Yeah, because you're right, Charles. It's not unheard of. It is here on Transformation Tuesdays. 140 pounds. If you're inspired to start your own weight loss journey, you could reach out to Charles by calling that number right there on your screen. Once again, congratulations. You look incredible.
Awesome job.
Thank you so much, both of you, for being here today and for sharing some good news this morning. And we'll be right back.